Today, we're going to have a discussion about why nursing may be a great career choice. When I think about nursing, I think about as a high school student, I wasn't sure what I was going to do. I didn't know what my next plans were going to be, but I knew I wanted to be a nurse. When I thought about nursing, I thought about how could I help others? I thought about how could I bring information and education to empower people so that they could actually have a healthy, prosperous life. One of the things that came to my mind was I could see myself in that nursing uniform. Now, I laugh about that today because many nursing schools don't require that you wear the funny looking hat that we had on our heads back then, or the white pantyhose, or the white bobby pins to keep the cap in place. But some traditions never change. And that is most people that choose nursing as a career, they do so because they ultimately have a desire to want to help. Now, I do know some people say, well, nursing is a great profession because you're always going to be needed. And that's true. Others say, well, I'll always be able to take care of myself. Well, that is also true. But you have to think about when you aspire to become a nurse, there will be days where you will question why you ever decided to step into this profession, because you will literally work long hours. You will constantly hear the concerns of patients. And let me tell you, taking care of people that don't feel well isn't always easy. But when you know this is the profession that you chose, even on the bad days, you can look at yourself and come to the conclusion, this is where I'm supposed to be. I recall 32 years ago trying to make the decision, was I going to be a nurse? And I can honestly say I had people along the way, amazing mentors, that not only helped me solidify the decision, but they put tools in my tool belt. And some of them I want to share with you today. One of the first things that came to my mind was I wanted to make a difference. I really wanted to be able to help. And I wasn't quite sure how I'd be able to do that. So once I decided to become a nurse, I started talking to people that were already working. And I'd ask them the hard questions. Why did you become a nurse? Why do you continue to be a nurse? What's your worst day like? What's your best day like? Do you think you made the right decision? And each person, they all said one key thing to me, and that was every day is not easy, but I made the right choice. I have run across some that have decided maybe this isn't the specialty for me, and they chose other specialties. But I've never run across any of my colleagues or friends that said it was a bad decision for them. As a minority, I really want to speak to some of the challenges you will face when you make the decision to go into nursing school. There are a lot of requirements for nursing school. One of the first things you have to think about, are you up for a strenuous, rigorous curriculum? You have to get your mind prepared because everybody is always going to tell you. One thing I know about nursing school was hard. I used to actually tell my students all the time, I was in the military and I served 11 years in 2 branches. I could do boot camp again, but I was never going to do nursing school again. That means I had to do it right the first time. I had to make sure I chose the right school. I had to do my own research. I had to talk to some people that were actually in those programs. And I had to go and look and see online and in person. For me, it was in person. What resources did they have to offer to make sure I got across the finish line? When choosing a nursing school, you have to know there is no such thing as the perfect program. People are always struggling in some areas. They're stressed out. You're barely eating or overeating. It is a lot. But I want you to do something that I always have done in my life. And that is, I look at how many people sign behind their name RN. And then I realize if they could do it, I could do it. I want you to also think about the preparation that is required when you decide you want to be a nurse. Number one, for most of us as minorities, finances are an issue. Nursing school is expensive. The books, even 30 years ago, I still paid about $500 a semester for my books. Now, when I thought about that, I always heard counselors, faculty, some of our advisors, they would say things to me like, you're not going to be able to work and go to school. Well, for some of us, we have no choice. I worked and I went to school. But what did I do? I partnered with an employer that will allow me to have the weekdays off. And then I went to the hospital on the weekend. I started working Friday night shift. I then worked Saturday days, Saturday nights, and then I ended with a Sunday day shift. So I literally would find an empty room and I stayed at the hospital over the weekend to get my hours because I had to work full time. So what did that mean? That mean I had to have great time management because I still needed to study. Those of you that are considering and aspiring to be nurses, one of the things you will hear said to you all the time, for every credit hour of a course you're taking, you need at least 3 hours of study time. That's true. After all, your professors are trying to teach you how to think like a nurse, and that does not come easy. You have to be able to embrace critical thinking. You have to be able to take exams. Oh my goodness. When you think about nursing exams, that in itself will cause anxiety because you probably have never had tests before in which every answer is right. So get this, I'm going to give you a tip. I learned that when I looked at those responses, I had to think of the one thing that I could do that would be safe and that would leave my patient alive. And when I thought about that one thing and I had a rationale to support it, I could circle that answer or click that choice and walk out of the room knowing that patient was well taken care of. You cannot allow those types of exams to hinder you from being able to get where you want to go. I remember a quote in The Great Debaters, and every class that I taught, I always started off with this quote. Denzel Washington was telling the debate team, you have to do what you don't want to do in order to do what you want to do. It was something like that. But in a nutshell, what he was saying is, no matter what you choose to do in life, there are going to be some things that you like about it and some things that you don't like about it. And that's true in nursing school. Most students don't like the way we test as educators. But you get through what you don't like so you can get to what you do like. That's just another example. You also have to make sure that you have buddies. Now, most of you probably think, when I was in high school, I got all A's. I did very well. I didn't have really any real issues. Some of us may not have had that as a story. I came from a very busy city, had lots going on. I tried to stay involved. And what I quickly learned is if I was going to be successful in nursing school, I had to put the time in. I had to study. And unfortunately, high school did not prepare me for what I was facing in nursing school. So I literally had to learn how to take notes, how to read a textbook, and how to approach those items on that test. Studying was not a strong suit, but I quickly learned. And one of the ways that I did that, I had a study buddy group. My house happened to be the one every Friday night or every Saturday night. It was one of those nights. You could find my dining room table in my mom's house filled with nursing students. And when we started to get tired and we started to fade out, you would quickly hear my mom tap the table and she would say, wake up, we're making nurses in here. And she would keep the snacks coming and she kept the coffee coming. And that's what it took. Sometimes I hear students say, I don't study well in groups. My response to that is always something simple. You don't have the right group. Anytime you can't get together and bounce off critical thinking ideas that you've just learned, practice questions, do what we call concept maps, and you'll learn more about that. When you don't have a group that can pull their thoughts out and help you, you probably won't be successful. Why? Because we don't all think alike. So somebody is going to be better at a topic that you're not good at. And guess what? In a group, those that are good at what you're not good at can help to strengthen you. Nursing school is a place where you really have to embrace you are your brother's keeper. You cannot allow yourselves to think that you're going to conquer it all by yourself. Most of the time, you will need others to lean on because the stress is real. The tests are hard. The programs are rigorous. But always remember, if you put in the disciplines, you can do it. The financial strain. I want you to consider what program is best for you. For many people, you cannot take 4 years to become a nurse because that might mean 4 years without making any real money that helps to support your family. I often will advise one of the best things you could do is be real about your situation when it comes to your finances. If that means you might have to start off maybe as a LVN or LPN, licensed practical nurse or licensed vocational nurse, wherever you work. That might be your choice. Why? That program is shorter. In most places, it's about a year. But what does it do? It gives you the opportunity, if you started off as a certified nursing assistant, it's your first step into the nursing door. And now you've increased your income a little bit. The other thing that it does for you, a lot of employers will pay for you to go back to school to get that RN. So now you've taken some financial pressure off of yourself. I want you to humble yourself. I want you to think about those family members that want to see you succeed. And guess what? You're going to ask them to help you financially. That uncle, that aunt, that mom, that dad, those sisters and brothers, sometimes even friends that just say, oh, you would be so good as a nurse. Then you ask them to put their money where their mouth is. And you ask them to give you some support. Now, you can't be proud trying to get to where you want to be. Sometimes it takes asking. And when you ask, the right person will respond. Make sure you also think about how to best manage your time to make sure you can get all the studying in that you need. You're going to make sure you focus on reading the material before class. You're going to have your notes ready before they even begin the lecture. Why? So you know what you're waiting for the faculty member, the professor to clarify. And if they don't clarify, guess what? You're going to raise your hand and ask that question. If you go into a lecture and you haven't even touched the material, you're setting yourself up for failure. You want to be able to hear the information multiple times because after all, you're learning a new language. You're learning how to think different, critically, make clinical judgments, and you are taking care of people. Somebody's life is going to be in your hands. So what am I saying to you? I don't want you to focus on how difficult it's going to be. That's your reality. I don't want you to focus on what you don't have right now as you're trying to make the decision. Do I want to jump into nursing? Where should I start? How does this begin? I want you to really focus on how you're going to start with your end in mind. And in doing so, you're going to make sure that you think of everything. If you have children, who's going to help you with the kids? Clinical hours, they start early and they end late. You are going to most of the time work 12-hour shifts. That means your clinical day, you may have to be at the site by 6:30 in the morning, and you won't leave sometimes until 6:30 at night. Now, that's just your arrival and your departure time. You still have to wake up, you still have to drive and prepare yourself because sometimes your clinical sites are far. You might be an hour to an hour and a half away from where you live. But guess what? We can do anything for a small amount of time. Always thinking, I'm starting with the end in mind. And in order to get to that end goal, you got to do what you have to do so you can do what you want to do. Clinical is just one of those things. Some of your faculty may not really embrace new students. What am I saying? I think many of us have heard that old adage that nurses eat their young. Well, I'm here to stamp that out. Although not all faculty have the same personality, they don't all communicate the same, they don't all have the same drive or connections with their students. I want you not to look at the faculty as what you wish they were, because you will never get the professor, you will never get the instructor, you will never get the faculty that you want. You're going to get the one that's available. And you've got to be able to open up your mind and embrace how they teach, how they relate to their students. And you have to see it as a positive, because if you see that as a negative, it's a hindrance to your success. No matter where you go in life, there are going to be people that you may not particularly get along with. Faculty are no different. But what are you trying to do? You want the knowledge that they have in their heads to be imparted into your head. Keep the end goal in mind. Don't allow your emotions to get you caught up. Don't allow them to make you feel as if you're defeated. Here's another tip. No matter what direction you go, no matter what level of success you try to attain, we all deal with the imposter syndrome. We all feel like, do I really belong here? Are these the steps I really should be taking? Well, you really won't know until you try. I am Dr. Shiela Ford, the nurse doctor.